A very good morning to you this Wednesday, trusting that you are well. You're right on time for KTN News Center. My name is Grace Nganga. Welcome to the broadcast. And now, although Kenya has made remarkable progress in reshaping the trajectory of the HIV pandemic, the AIDS-related deaths and new HIV infections have stabilized at high rates, emphasizing the critical need for intensive efforts. This was unveiled during the recent World Day celebrations that was held in the country early this month. This morning, we want to talk about eradicating HIV and AIDS and how best we can go about it as a country. Join me for that discussion. With me this morning, in my immediate left, we have Duke Moai, who is a youth champion chairing the meaningful involvement of youthful persons in the Republic, who's also advising MOH and its partners on sexual and reproductive health. We also have Mariel Rono there, yes, who is a lecturer and researcher of applied mathematics and infectious disease modeling. Thank you so much for gracing us today when we're talking about matters HIV and how to eradicate it. Of course, you know that Kenya has an ambition of getting rid of the infection for children and adolescents by 2030. Of course, that is quite a journey. Yes. And when we come to you, Marilyn, of course, we know that there is the chat box. No? Yes. It's a new innovation. Let us begin with that conversation by understanding what exactly that is, why was it invented, and for what particular purpose?
Okay, thank you so much for that question, and it's a pleasure to be here this morning. Yes, there is an ambitious plan indeed to end the new HIV infections by the year 2030, and a recent research that we did actually showed that that is quite an uphill task to achieve, right? To enable this to end new HIV infections among adolescents and young adults, then we need to ensure that the adolescents and young adults who are engaging sexually know their HIV/AIDS status, are willing to disclose their HIV/AIDS status with their sexual partners, and at least, if not both partners, at least one should be able to disclose. That is the only way that we will work towards ending new HIV infections among the adolescents and young adults. So where we stand is we thought of how do we come about then encouraging the youth to test for HIV and AIDS. As it is, we have very low rates, HIV/AIDS testing rates among the youth. And to encourage the youth to test for HIV and AIDS, we thought of why not use an artificial intelligence tool? That is how we came about with the HIV chatbot. Mm-hmm. So we have been working on this to ensure that the youth have a free space. What we realize is the youth are not talking to responsible people who can advise them. The youth are not going to test for HIV and AIDS. The youth are interacting sexually. They're in the experimental phase. So we need to reach them where they are. Where are the youth? We find the youth in the phones. So we thought of coming up with an innovative technological tool driven by artificial intelligence agents to allow them to have these conversations and to help them become free to be able to interact. It should be able to encourage them and enable to make them free to disclose their status.
So with this particular application, perhaps you can tell us, if I signed up to it,
yes,
who am I speaking to? Am I speaking to somebody? Yes. Is this a robot? Who is replying to all my questions that I'm asking this unseen somebody?
So we have coded it in such a way. Mm-hmm. This is an algorithm that we are currently working on to ensure that it's just you and the application that are interacting. There is no intermediary person. There is no somebody behind, no human being behind. It's just you and the application, right? Mm-hmm. So it's an intelligent agent mm-hmm. that we are training to have this conversation with you. Mm-hmm. So ask it any questions regards HIV/AIDS, sexual and reproductive health. You know, it should be able to have this conversation with you without making it feel like it's a robot per se, right? We are training it to empathize, we are training it to have that personal connection with you so that you can almost feel like you're talking to a human being. Yes.
Duke, maybe if I come to you, I understand that you've used that particular application. First of all, what attracted you to use it?
One, as a young person, it's so uncommon to find a person you can really talk to directly, and that person to get an understanding of exactly what you want. So when I got the website of this AI launching, I found my Jesus in it. And the reason as why I found my Jesus in it, because I can ask any kind of question without fear that someone might discriminate me, judge me, try to, ask more questions. You see, when you ask a question and you get an answer, you're satisfied. But sometimes a human contact produces more conversation that is quite unnecessary, especially for us young people.
But maybe if I can ask you, don't you think talking like the way we're talking one-on-one, there's that emotive or emotion that is there, meaning that I can understand you and you can feel it. Now we are talking to something. I don't know, something.
Yes.
How different is it now that you've used it? How different when it comes to emotions, or is it just good because you're pouring out your heart to somebody that will not judge you?
You see, talking to someone who've done it before, it has been there since ages. Unfortunately, we haven't gotten the solace that we've always required from that emotional touch. And as young people, most of our time we've spent them on social media, on our gadgets, on our laptops, on our iPads, MacBook, mention them, any other kind of gadget you might be having. So this app that is now in my gadget is now my personal, my personal person who I can walk with in my journey of life and ask it what kind of question that I might be having regarding to my sexual and reproductive health.
Ron, perhaps you can tell us, since this website was created, what feedback are you getting from people? Do you have data for us to know that this is a number that so far have enrolled? What is the demographic, the age group and all that, perhaps?
All right, so just to put things in perspective, it's a project that is ongoing at the moment. Duke came to know of us because we described the project in our website, Innovate AI Health Lab, and he just looked for us immediately and called our contacts because they had been thinking of how can we reach the young people, right? So the information that we have or the data that we have is from the ground. We have the project is working in 2 counties, Embu and Murang'a counties at the moment. We have met the youth, adolescents aged 15 to 24, both female youth and male youth. They are all excited and looking forward to this. Why? It's awkward to talk about sexual health, honestly. Parents are not free to have these conversations with their children. So the burden has been left to teachers or biology teachers, And if they are not getting adequate responses towards this, then who else do they go to? They go to their phones. They Google, and Google will send them to websites. So you will literally be mining for information rather than have this information at just a touch of a button. So they are eagerly waiting for this application too. Which we are in our final stages, as we mentioned earlier, of coming up with it. And it will do away with the awkwardness of talking about sexual health, facing a person. Like, we at this stage, we are okay talking about it, so we can face each other about it, but the young people are shy. They would rather hide behind their doors and search, in their privacy.
Yes. Out of curiosity, maybe, what are the most asked questions?
Yes. So we got the questions from the young people that we are using it to actually form the knowledge base of the chatbot. So to create the knowledge base, we went to the young people to ask them. So they're curious about what is sex, whether it can help, whether they can get HIV the first time, whether I can be cured of my HIV by sleeping with a virgin. You know, the youth are still asking these questions. There are a lot of misconceptions. If they have funny looking rashes, does it mean they have HIV? The space of the youth is, the world is quite interesting. It's not the way we view things. So they're asking about where can they get help? You know, where can they go for, if they feel they have a sexually transmitted infection, if they suspect, where can they get help? I had sex yesterday night, will I be pregnant? You know, those are the questions the youth are asking. How do I avoid pregnancy, you know? So while we took to the ground thinking we are bringing a HIV chatbot, we came up with interesting things, and we realized the youth are, it's not just HIV matters that is of interest to them. They're worried about sexually transmitted infections, and those who have them are worried about, they just have these emotional issues they're carrying around, and they do not know where to seek help. Yes.
All right. And as we are talking about eradicating HIV and AIDS, earlier had said that the country has a vision of trying to eradicate this disease by 2030 to children and adolescents. Perhaps you can tell us, what should Kenyans do to ensure that that vision is actually actualized by 2030?
Actually, 2030, that's a global timeline. In our republic, the president and the CS Health have a commitment to eradicate HIV in children by 2027. And that's why currently we have an ongoing PMTCT RRI that has run countrywide for around now 90 days. They have been targeting 100 days. But the main challenge has always been reaching out to our communities. Because not unless we engage them directly, we are still lagging behind. Actually, the theme of World AIDS Day this year has been let communities lead. I was joking to her, telling her, unfortunately, communities are leading from behind. We are seeing the big, big donors withdrawing from us without a clear perspective of what is really happening. We are saying we're still having a challenge. We're saying we're still having a problem when it comes even to our youth-friendly centers. We are really facing great and big challenges when it comes to addressing these issues. Currently, if we are talking about young people and new HIV infections, they are contributing to over 50% of new HIV infections annually. That means when 10 people contract HIV, around 6 of them, these are young people between the ages of 10 years to 24 years. That is so surprising. And it has also led us to the data of saying that our sexual debut as a country is at 12 years. That means a child who is at 12 years have either experienced or done sex. Yes.
Rono, you are from a researcher perspective view. What is it that Kenyans need to do so that this thing is actualized? Because we might just be saying that that is our vision, 2030 comes, perhaps it hasn't worked. Then again, maybe we say 2037 and so on and so forth. So what is the missing link and what should be done?
The missing link is the community needs to accept what works, you know. We need to encourage the youth with what has worked for the general population. We've seen over the years a huge reduction in new infections in the general population. So we need to encourage the youth, first of all, by speaking openly, giving them age-appropriate sex education. Secondly, those who are engaging sexually, they should be encouraged to use condoms, you know. We know that works. They should be encouraged, we shouldn't judge them, you know. We should have this space where we are talking with our young people, but we are not judging them or just basically having positive attitudes towards the youth. When they approach you, talk to them, you know. Don't judge them, understand them, see how you can guide them. Those who are HIV infected, I think while we don't talk much about it, stigma, I believe, is still there. That's why a young person will not come to you and say, hey, I am HIV HIV infected, people will throw, people will stop interacting with that person. So we need to stop stigma completely. We need to approach these young people when they have talked to us. Let's be open, have these conversations. And I want to say this conversation starts from the home. Are parents accepting? It's a question we asked randomly in one presentation that was a bit young, generally young. Actually, I think in that space, the oldest person had a 15-year-old son. And we asked him, are you willing to talk about, okay, your boy comes home and say, hey, Dad, I had sex yesterday with my girlfriend. The reaction was, what? I'll get a stone, I'll get a stick, The reaction is, and it was generally there. I asked a lady who had a 12-year-old daughter, she has said the age of sexual debut is averagely around 12. So your daughter comes and says, Mom, what did I feel, I don't know whether I may be pregnant, I had sex yesterday. The mother is like, ni nani huyo, who is that son? I want to meet that person. Yeah. That is the reaction. So let's leave alone the older generation. We are talking of parents who have young children now, who are of a younger demography, and they still bear this. It's a difficult talk with their children. So we need to start from that space. Be open, let's have these free spaces, and let's talk to our children. Let's not judge them. They are living in an age of information. They will get them, whether you talk to them or not, they'll search for it. We leave them home with internet, don't we? It's a long holiday season. What do you think they're doing? They're curious. Yeah. So they will search, they will find it. So if we don't talk to them and give them the correct information, they'll be led to misinformation. They'll fall prey to misinformation. All these myths around sexuality, they will be that is what will attract them. They'll talk to their peers. So if you are to end new HIV infections, if we do not want to push the timeline, conversation has to start now. We need to talk to our young people. Those who are engaging, let's show them where they can find help, where they can be responsible about it, what they can use to prevent it. These are conversations that we must start having now. Yes. All right,
from that conversation, I can easily tell why you are interested. You and your team were interested in coming up with that particular. Yes. But let us talk about funding. He mentioned funding.
Yes.
And the US is telling Kenyans, now you're on your own.
Yes.
You can fund yourselves. Perhaps just that statement.
Yes.
I believe it has had repercussions in different maybe centers.
Yes.
Perhaps you can take us through that.
Sure. Actually, apart from funding, we are calling it the journey to self-reliance. But I don't think as a republic we are really ready for that, because even when you check on our budget guidelines, we don't really have a clear provision of how much is going to HIV response. When it comes to young people and the funding and all those issues, most of the youth-friendly centers in the Republic are donor-funded. So that means, that one statement means all our youth-friendly centers might shut down soon. And that means wherever we used to get a little solace or hope will be no more. So that means it is no longer the last mile, it will actually now bring us back to the first mile. Wherever we started, we will be heading back there, because this particular generation that is contributing up to new 50% of the new HIV infection is the same generation that we really rely on the youth-friendly centers. So I think we are not really ready for that as a country, and I think it's a conversation that should be a bit high profile, and we make sure even in our budget guidelines, maybe we can have a provision for the HIV response.
So now, as we say that centers are being shut,
yes,
we have this magnificent vision of 2030.
Yes.
Do you think that really is helpful, or it will work towards that?
I think when you talk about Vision 2030 and in relation to youth-friendly centers, we have really shifted gears to our young people to more sporting and creativity aspects. We have not really invested when it comes to their healthcare system, their healthcare welfare. We have really just thought, what do these young people really require? Maybe sporting field, maybe creative hubs, maybe we talk about these general hubs, maybe an ICT hub within. Right now, I understand we have almost every ICT hub in each and every constituency, but we don't have a youth-friendly center in each and every constituency. Maybe you'll find that there is one in a whole county. So I think we also need to enhance when it comes to empowering these youth-friendly centers, even if that means county government to take over on them, or the national government to take over on them. I think it's a conversation that should be ongoing.
So, still on matters funding, funding is huge when it comes to also eradicating and helping the persons that are infected the particular disease. How, from your research as well, how will us losing this funding affect us and also affect the persons who depend on that amount or that whichever help that comes from abroad?
All right, so I'll talk on this from modeling perspective. We look at it this way. When we withdraw something that has already been proven that works, we risk reversing the declining trends of HIV and AIDS. And this I actually demonstrated also in one of my research, that the minute you withdraw and you increase, so that will what will happen is the youth will stop or rather slow down using this. Maybe they'll be forced to buy condoms, maybe where previously it was free, or they'll be forced to buy or walk longer distances, challenges of poverty, money, fare, things like that. So we are at a very delicate space where we risk reversing the declining trends, and what we will see is an increase in HIV prevalence. And I'm targeting the young people per se because, they are vulnerable. Yes, so then what is likely to happen is a reverse in the declining trends, and we'll start seeing increase in prevalence rates.
So perhaps should the government start setting aside like budgets for that particular disease in maybe subsequent?
Yes, we can't run away from that. What I like about the Cabinet Secretary Health vision is bringing health to the young people on their phones. She has that ambition, and I think that is timely. Besides setting aside budgets, which is a must, there are things that need funding, and we need to meet the young people where they are. So there's this ambitious plan to improve digital health and have the youth access it on their phones. And that is where we come along. We are at that space that aligns with the vision of the Cabinet Secretary Health, Ministry of Health. If we want to reach the young people on their phones, at least we are working towards that, by this HIV chatbot project. We are heading towards there, because this is almost a reality. It's almost happening. If we have their goodwill, we partner together, we can achieve this even in the coming year. Yes.
Let us now talk about mother-to-child transmission. Of course, that has always been an issue for so long, and that is also something that, as Kenya, we are hoping to eradicate in the near future. Do you think that is workable?
Yeah, mother-to-child transmission, I think you can also speak about it. In my opinion, and using the data that we have seen around, the measures that have been put in place works, right? Most of the women, I think there's been a lot of improvement in maternal health. So mother-to-child transmission is not such a big issue now as it was in the past, because a lot of care has been put in place, a lot of budgets, a lot of support has been, mothers have been accorded. The good thing is, the minute you're pregnant, and that's why HIV testing rate is higher in females, and 15 to 24 is the reproductive age group in the country. So anyone seeking pregnancy support, antenatal care, will definitely have to test for HIV. So in the process, you will know who is HIV infected, and immediately they are given the support to ensure that mother-to-child transmission doesn't take place. So we have made, sincerely speaking, great gains in preventing mother-to-child transmission. Issue happens now in the population group that has to decide for themselves, you know. So that's where we are, focusing on the adolescents and young adults who have now joined the club of vulnerable populations.
Yeah.
Yes.
Duke, perhaps you can talk to us about adolescents, because Ron had told us earlier that most of the questions being asked are, I had sex, it's all about sex and sex this and sex that. So, and we're talking about trying to eradicate HIV when it comes to adolescents. But clearly from what she told us, youths right now are active.
Yes.
So when we're talking about eradicating it, and our youth are active, there is, it's not adding up. So,
our young people are very much sexually active, and remember, we also have a lot of time on our social media, so we are really so good in networking. We are really talking to our peers who are very, very far away, and they commute and come meet us. So when it comes to sex, we must all agree that our young population is very much sexually active. And that comes along with the teenage pregnancy data.
Yes.
If you check even in our maternities, most of our young people, actually most of the mothers who are giving birth are our young mothers. Do I call them young mothers or young babies giving birth to babies? We don't know the right name to give them. But apparently, that's the sad truth. And that's now when we are capturing this data of HIV, the new HIV infection. Since when this young teenager comes pregnant on their first ANC, they must be subjected to mandatory HIV and AIDS test. And that's where we get the new HIV infection coming in. So that means this particular young person slept with a young man. So we are also missing out on the data of this particular young man, or might older. Be an older generation, because still our country is also prevalent when it comes to transgenerational sex. Our young people, our young people once more are also afraid of pregnancy than new HIV infections. So we are really rushing to our local chemist and getting services on how to eradicate pregnancy, but unfortunately we are not getting services on how to eradicate new HIV infections. And still we also have those services because we have the provision of PrEP and PEP, which we probably will discuss along the conversation. Yes.
So do you feel like we will get there by 2030? If at all, the chat box is telling us clearly that the youth out there, that is what they're asking.
Now with the chatbot, it will lead us to a focused direction on which issues to address. I think over the years we've been misaddressing issues with our own thinking, without the thinking of the young person. But once the young person brings us to the table and tell us, hey, look, I need to know how many times do I need to have sex so that I may transmit HIV. I need to know how do I get my viral load done, and at the same time not infect my partner, and not even my partner let him or her know that I'm HIV positive. I think with such kind of a conversation and such kind of data, it will also lead our government to understand where to invest more. Yes.
All right, things are getting quite interesting here. Here on Kitchen News Desk, we take a very short commercial news center. We take a very short commercial break, but the conversation is ongoing after the short commercial break.